Hello, my friends. I'm Dr. Eliza, a urologist and men's health specialist with 5 years of hands-on clinical experience. And today, I want to share guidance that many men go their entire lives without ever hearing. The kind of honest, educational conversation that may feel a little uncomfortable at first, but has the power to transform how you think about. But here's the thing. The most powerful tool you have for your sexual health isn't at the pharmacy. It's probably sitting in your hallway right now, inside a pair of sneakers you haven't touched in months. I'm Dr. Emma Blake, and today I want to talk about a study that frankly doesn't get nearly enough attention. About intimacy, confidence, relationships, and even your long-term health as a man. And before we begin, I invite you to support this learning community by liking the video, subscribing to the channel, and sharing in the comments where you're watching from. Because it truly means a lot to see how men from busy cities, quiet rural towns, and every place in between come together to learn and grow. Now let's talk about an important truth that is rarely discussed with older men, which is that intimacy does not retire and desire does not disappear simply because the years pass. Yet I see far too many men who quietly withdraw from closeness because they believe they are too old, too broken, or no longer capable. When in reality, many of the challenges they face are not caused by age alone, but by small, very manageable habits and misunderstandings that can be changed starting today. And one of the most common areas men ask me about involves intimate practices that feel taboo to discuss, but are actually deeply connected to trust, pleasure, emotional safety, and overall relationship health. Over the past 5 years, I have worked with men in their 50s, 60s, 70s, and beyond. And what science consistently shows is that when men understand how the body truly works, including biology, emotional responses, and everyday lifestyle factors, they make better decisions, reconnect more deeply with their partners, and rediscover a sense of freedom and confidence they once thought was gone. So today, I want to walk you through several key truths and common mistakes men make regarding intimacy, bodily fluids, communication, and connection, each one building on the next, beginning with a misconception that causes unnecessary shame, which is the belief that vaginal fluids are dirty or something to be avoided, when in fact, these fluids are a remarkable and carefully designed function of the human body, produced by structures such as the Bartholin glands, which release smooth fluid to reduce friction, the Skene's glands, sometimes referred to as the female prostate, which contribute to lubrication during arousal, and the cervix, which produces mucus that helps protect and balance the vaginal environment. And these fluids are primarily water combined with amino acids, enzymes, minerals, and lactic acid that work together to protect delicate tissues, maintain healthy pH, reduce infection risk, and support comfortable, pleasurable intimacy. And when a man reacts with judgment or rejection toward these natural processes, it can unintentionally create shame, erode trust, and make intimacy feel emotionally unsafe. So the healthier shift is to view these fluids not as something unpleasant, but as a biological signal that the body feels safe, relaxed, and ready for connection. Another common mistake is becoming overly focused on taste or smell without understanding the natural reasons for variation. Because vaginal fluids can change based on hydration, diet, stress levels, hormonal fluctuations, medications, and life stages such as menopause, with fruits, adequate water intake, and balanced nutrition often contributing to a milder profile, while foods like garlic, onions, alcohol, and coffee can create stronger notes, and hormonally, the body shifts throughout the menstrual cycle, sometimes producing a neutral scent around ovulation, a slightly metallic note near menstruation, or reduced lubrication after menopause due to lower estrogen levels, all of which are normal. And while a sudden strong odor accompanied by discomfort may signal a common and treatable condition like bacterial vaginosis or a yeast imbalance that deserves medical attention, normal variation should never become a source of criticism, because acceptance is far more arousing and relationship strengthening than judgment. Another critical area men overlook is safety. And while for healthy monogamous couples, vaginal fluids are generally safe and biologically less risky than many everyday activities people think about. But here's the thing, the most powerful tool you have for your sexual health isn't at the pharmacy. It's probably sitting in your hallway right now inside a pair of sneakers you haven't touched in months. I'm Dr. Emma Blake, and today I want to talk about a study that frankly doesn't get nearly enough attention. Nothing of, they can still carry sexually transmitted infections such as chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, or HIV, particularly if one partner has an active infection or if the other partner has mouth sores or bleeding gums, which means the foundation of true intimacy is not avoidance, but honesty, mutual testing, and open conversation, especially in new or changing relationships, because assuming that no symptoms means no risk is one of the most common and dangerous misunderstandings. Another damaging habit is staying silent out of embarrassment, as I have seen many couples lose closeness not due to illness or lack of attraction, but because unspoken concerns about changes in smell, comfort, or curiosity about intimacy slowly grow into shame and emotional distance, even though the body naturally changes after menopause, illness, stress, or dietary shifts. And when concerns are hidden, partners may misinterpret silence as rejection, allowing small, easily addressed issues to become barriers to connection, while respectful communication rooted in curiosity and kindness keeps intimacy flexible and resilient. Above all, the most powerful lesson I can share is the emotional impact of acceptance. Because when a man fully embraces his partner, including her natural bodily responses, he communicates trust, safety, and unconditional acceptance, which biologically helps the body relax and increases natural arousal. Emotionally helps release years of quiet shame many women carry, and practically makes intimacy lighter, more playful, and free of fear, reminding us that intimacy is never just mechanical, but deeply emotional, and the strongest performance enhancer is not a pill or device, but a partner who feels completely accepted. From a practical standpoint, this understanding can be applied through simple steps such as having open health conversations and suggesting routine testing together as a sign of partnership rather than suspicion, paying attention without judgment by noticing changes and addressing them as a team through hydration, shared hygiene routines, or supportive medical visits when needed, and practicing daily acceptance by reminding yourself that individuality is not a flaw and that natural fluids are signs of health, trust, and readiness. And while it's normal to feel shy discussing these topics, it's important to remember that nearly every man I see in clinic asks these same questions, and that couples who talk openly often find their intimacy not only survives, but deepens, because safety does not diminish romance, but instead builds the trust that allows passion to last for decades. And the final message I want to leave you with is that passion does not retire. And your 60s, 70s, and even 80s can be some of your most confident and connected years. If you let go of shame, care for your health, and approach intimacy as a shared journey, avoiding gimmicks and unsafe solutions, while focusing instead on communication, education, and mutual respect. And if this message resonated with you, I encourage you to like, subscribe, share it with another man who may need reassurance, and let me know in the comments where you're watching from and what topics you'd like covered next. Because I'm Dr. Eliza, and I want you to remember that small, informed changes can restore comfort, confidence, and connection. That passion does not expire, and neither should your belief in your ability to enjoy a healthy, meaningful, intimate life. Expanding on this topic further, it is essential to understand that intimacy is not a single act, but a complex interaction of physical health, emotional safety, communication patterns, lifestyle choices, and cultural beliefs that shape how men and women experience closeness over time. And as men age, physiological changes such as reduced testosterone, slower arousal response, or increased sensitivity to stress can influence sexual confidence. Yet these changes do not eliminate desire or capacity for pleasure, but instead call for adaptability, patience, and education, because the nervous system plays a central role in arousal, meaning that chronic stress, unresolved emotional conflict, or fear of performance can inhibit intimacy far more than age itself, and learning relaxation techniques, practicing mindfulness, and maintaining open dialogue with a partner can significantly improve both sexual satisfaction and overall relationship quality. It is also valuable to recognize that women's bodies evolve across the lifespan, with hormonal transitions such as perimenopause and menopause, affecting lubrication, tissue elasticity, and sensation, which can be supported through medical guidance, lifestyle adjustments, and emotional reassurance. And when men understand these changes rather than personalizing them as rejection, couples often find new forms of intimacy that are equally or more fulfilling than those of earlier years. Nutrition and hydration deserve special attention as well, because adequate water intake supports healthy mucosal tissues, balanced blood sugar, and circulation, while diets rich in fruits, vegetables, healthy fats, and lean proteins provide the micronutrients necessary for hormonal balance and tissue repair. And limiting excessive alcohol and processed foods can improve both genital health and energy levels, reinforcing that sexual health is inseparable from overall wellness. Physical activity is another cornerstone, as regular movement improves blood flow, cardiovascular health, mood regulation, and confidence, all of which directly influence sexual function, and even moderate activities like walking, stretching, or strength training can have meaningful benefits when practiced consistently. Sleep quality should not be overlooked either, because poor sleep disrupts hormone production, increases irritability, and reduces resilience to stress, which can quietly undermine intimacy over time. Beyond the physical, emotional literacy is crucial, as many men were raised without the language to discuss vulnerability, needs, or fears. Yet, developing the ability to express emotions respectfully strengthens partnerships and reduces misunderstandings that often manifest as sexual distance. Trust-building behaviors such as listening without defensiveness, validating a partner's feelings, and approaching challenges collaboratively reinforce emotional safety, which is the foundation of satisfying intimacy. Education also plays a key role, as misinformation and myths about sexuality persist across generations, leading men to believe that decline is inevitable or that desire should look a certain way, when in truth, intimacy is highly individual and evolves with experience. And learning from credible medical sources empowers men to make informed decisions rather than relying on fear-based marketing or unsafe shortcuts. It is equally important to address mental health, as depression, anxiety, and unresolved trauma can significantly affect libido and connection. And seeking professional support is a sign of strength rather than weakness, contributing not only to better intimacy, but to improved quality of life overall. Cultural attitudes toward aging and sexuality often discourage older adults from embracing desire, yet research consistently shows that emotional closeness, affectionate touch, and sexual expression remain important contributors to happiness and cognitive health well into later life, reinforcing that intimacy is a lifelong human need rather than a youthful privilege. Communication strategies such as setting aside non-distracted time to talk, using I statements instead of blame, and expressing appreciation regularly can prevent small issues from becoming entrenched patterns of avoidance. Curiosity and playfulness also deserve space, as approaching intimacy with a sense of exploration rather than performance reduces pressure and invites mutual enjoyment. Understanding consent as an ongoing, enthusiastic exchange further strengthens trust, ensuring that both partners feel respected and valued at every stage. From a medical perspective, routine checkups, medication reviews, and honest conversations with healthcare providers help identify treatable conditions such as hormonal imbalances, cardiovascular issues, or side effects that may influence sexual function, emphasizing that proactive care is an investment in long-term vitality. Finally, reframing intimacy as a shared expression of care, presence, and connection rather than a measure of adequacy allows men to release unrealistic expectations and engage more fully with their partners, creating relationships that are resilient, compassionate, and deeply satisfying across the decades. And by integrating education, empathy, self-care, and open communication, men can continue to experience meaningful intimacy that supports both physical health and emotional fulfillment throughout their lives.